chest pain.
All right, scene safety BSI.
Scene safety.
Got my goggles and my gloves on.
Bring your BSI.
Mask too. All right. Is this the nature of illness or mechanism of injury?
Nature of illness.
Okay. How many patients do I have?
You have one patient.
All right, I want to consider additional resources, consider C-spine. And what's my general impression?
Okay. You met at the door by his 21-year-old wife who leads you to the living room. He is laying on the couch and he follows you with his eyes from the doorway to the couch.
All right. Hey, sir, how you doing? Paramedic Jackson, what's your name? What's going on?
My name is Bob. I have chest pain.
Okay, Bob, do you know where you are right now?
I'm at home.
Okay, and you said you're having chest pain?
Yes, sir.
Do you know the year?
It's 2020.
Okay. Do I notice any life-threatening injuries at this time?
Nothing is obvious.
Okay. Since he's talking to me, I know his airway's patent and also know his breathing. I want to assess his rate, rhythm, and quality of his breathing.
Okay, his breathing rate is 22. It is full and regular.
Okay. Go ahead and assess his lung sounds.
Lung sounds are present and clear in all fields.
Okay. I'll place him on a nasal cannula at 4 liters per minute. I'm going to assess his radial pulse, looking for rate, rhythm, and quality.
Radial pulse feels a little fast. It is strong and regular.
Okay. I'm going to palpate his skin, looking for color, temperature, and moisture.
He's cool, pale, and diaphoretic.
Okay. Since he's talking, capillary refill?
Cap refill is less than 5 seconds.
All right. All right. Indication of good perfusion there. His fingertips go. All right. So since he's talking to him, I'll go ahead and do a focus assessment. Bob, can you utilize one finger to point to where that chest pain is happening the most?
Right here.
Okay. Have you ever had chest pain like this before?
Yes, I have.
Okay. When was the last time you had chest pain?
About 4 years ago.
And what happened during that time?
I had a heart attack.
Okay. Does this feel the same?
Just like it.
Okay. All right. So signs and symptoms are chest pain. Are you allergic to anything, Bob?
Penicillin.
Okay. Do you take any medications?
I used to take nitroglycerin, but I ran out, and I take vardenafil.
Okay, and what is that vardenafil for?
And it's for my wife.
It's for your wife.
Yeah.
All right, what are you doing that for with your wife?
Oh, she's 21, I'm 82. You know, I need some help sometimes.
Gotcha. You know when the last time you took that?
I took it yesterday.
Yesterday?
Yeah.
All right. All right, so any type of past medical history that I need to be concerned with?
I just have a heart history. That's it.
Okay, and last time you had anything to eat or drink?
I had a burger at lunch.
Okay, and what were you doing prior to this happening?
I was just watching TV.
Okay. So was this onset, was this a sudden onset or a gradual onset?
Oh, it just hit me.
Okay, and does anything make it better or worse?
No.
Okay, and how would you describe your pain right now?
Feels like someone's pushing on my chest.
Okay, and you said that pain started in the center of your chest.
Yeah.
Does that pain radiate or move around anywhere else to your jaw, down your arm?
My left arm feels kind of funny.
Okay, and on a scale of 0 to 10, with 10 being the highest, how would you rate your discomfort or pain right now?
This is an 8.
All right, and how long has this been going on?
Oh, probably about 15 minutes now.
All right, so I'm going to go ahead and obtain a blood pressure.
Okay, his blood pressure is 150 over 90.
Okay, and you said his pulse rate again was?
His pulse rate is 110, regular and strong.
His respiratory rate?
Respiratory rate is 22, regular and full.
Blood sugar?
Blood sugar is 100 milligrams per deciliter.
BGL?
That's blood sugar. Something else?
Temperature?
Temperature is 98.6 Fahrenheit.
And pulse oximetry?
His pulse oximetry is 93%.
All right, I'm gonna go ahead and improve to an hour, agree that 15 beats per minute. All right, so just having chest pain. That started about an hour ago. I'm gonna go ahead and assist him in medications, and I'm gonna go ahead and call for physician consult. So long rescue 1 requests a physician consult.
Rescue 1, go.
We have an 80-year-old male patient with a chief complaint of chest pain that started about an hour ago while watching TV. Patient states pain is approximately an 8 out of 10 on the pain scale. Requesting physician orders to administer aspirin. Patient does take sexually enhancing medications at this time. Do I have consult to administer nitroglycerin? He has taken a sexually enhancing medication within the last 24 hours.
Which one did he use?
Sildenafil.
Vardenafil. Okay. Now withhold the nitroglycerin, go ahead and administer 324 milligrams of aspirin PO.
All right, so prior to me administering this medication, I want to make sure I have my date dose documentation or outpatient medication. I'm gonna have aspirin. I'm gonna give 81 milligrams per tablet to a max of 4 tablets. I'm gonna give 4 tablets of aspirin. They're chewable. Make sure my patient's over the age of 16. He doesn't have any GI bleeding or strokes or asthma issues going on at this time. So, it's gonna chew his aspirin. We'll transport it, okay? Good so far? All right, so as we're transporting, we're gonna do a full body scan, all right? We're gonna palpate the back of the head, looking for decap, BTLS, deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, swelling. Feel or palpate the forehead for any foreign objects, looking at the eyes, making sure pupils are equal and reactive to light, making sure we do not have any periorbital ecchymosis, no conjunctiva, no hyphemia. We're going to assess the nose, looking for any sensitive nasal hairs, any bleeding, any cerebral spinal fluid. Come to the ears, looking for battle signs, cerebral spinal fluid, or bleeding. We're going to look in the mouth for broken teeth, dentures, bleeding, fruity breath smells, foul odors. We're also going to look at the zygomatic arch, the maxilla and the mandible, look for transmandibular junction or TMJ, also known as lockjaw. Come to the neck, making sure trachea is midline, negative JVD, positive carotid pulse, palpate cervical spine C1 through C7 for any abnormalities or stepping. We're going to palpate the upper chest wall, or excuse me, the clavicle area, or any crepitus. We're going to look in the upper chest wall for medication patches, defibrillators, or pacemakers. We're going to assess the suprasternal notch for subcutaneous emphysema. We're going to assess the chest. We're looking for equal chest rise and fall. No paradoxal or equal motion. If we haven't assessed lung sounds, we'll assess lung sounds. We also, since he's complaining of chest pain, we want to make sure we assess the chest. We're going to palpate each quadrant of the abdomen, looking for guarding tenderness, rigidity, pulsating masses. Hips, we're going to press in and down. We're feeling for stability, negative crepitus. If they complain of pain in that area, we do not press in and down. We're going to look in the genital areas. We're looking for priapism or any incontinence. We're going to palpate each leg one at a time, making sure they're equal length. Press against my hand, lift up against my hand, palpate for a pedal pulse. We're going to do the same thing on opposite extremity. Press down, press up, feel for pedal pulse. We're going to come to the upper extremities. We're making sure they're both equal. Making sure we have good PMS, post-motor sensory. Squeeze my hands, wiggle your fingers, feel or palpate for a radial pulse. We're going to assess the back from the head to the feet, looking for decap BTLS. We're also going to assess the neck, wrists, ankles, wallets, phones for medical alert tags. At this point, I want to reassess my patient. My patient's still, Bob, see, how you doing?
Okay.
All right, so you're still here with me. Are you still having that chest pain?
Oh, yeah.
Okay. I want to reassess all of my vital signs. Blood pressure, pulse, respiratory rate,
No
temperature.
significant changes.
Okay. Also want to reassess my pain level. All right, you said the pain was still an 8 out of 10, but is it still the same?
Oh, yeah, it's still an 8. Nothing's happened.
Okay. All right, so since the doctor told me to withhold my medications, I cannot administer any nitroglycerin at this time. We're done with that aspirin, so we're going to continue to transport our patient. Okay, and then we're going to encode Law Rescue 1, Priority 2 medical. And we're en route to facility with a 80-year-old male patient, chief complaint of chest pain that started approximately an hour ago. Patient states pain is substernal, radiating down his left arm. Radiating down his left arm. Initially, pain was an 8 out of 10. Patient consumed sexually enhancing medications within the last 24 hours. It was told to withhold nitroglycerin. Patient was administered 324 milligrams of aspirin. Current blood pressure of 150/90, pulse rate of 110, respiration is 18, saturation of 96% via non-breather mass, temperature 97, BGL of 100. Patient still relates that his pain is an 8 out of 10 on the pain scale. We should be around to your facility in about 3 to 5 minutes. Any questions or orders?